Why this story matters. This uplifting update focuses on solutions rather than problems, and that's worth paying attention to. Quick summary: this story highlights recent developments related to air, showing how constructive action can lead to meaningful results. Trained in air quality mapping, grassroots women leaders monitor air quality across 69 sites in rural areas of Bokaro and Dhanbad in Jharkhand, identifying 26 pollution hotspots. Despite the awareness about air pollution's health impacts, the study found that the public health system is unresponsive and inadequate. The research prompted immediate action, with the coal company installing water sprinklers, covering coal loads during transport, and setting up air quality monitors in public places. As coal mine workers begin their day in the village of Jharkhand, the first sound they hear is the whirring of heavy machines. Soon trucks loaded with coal from the local mines rumble down the roads. By afternoon the air gets bad. Courtyards swept clean in the morning are covered in dust again, said Rikadevi, a resident of the village in Jharkhand's Batari district. And it gets worse in the winter. Devi is a Paryavaran Sikha, a friend of the environment and one of the grassroots women leaders who co-led a recent community participatory research study published in the Canadian Journal of Action Research in March 2020. The study throws light on the impact of air pollution on public health in rural neighborhoods in Dhanbad and Bokaro, Jharkhand's two prominent coal mining districts. Would you like to read more good news about air village pollution, Indian Act, and companies? The research was jointly conducted by Nefas Sable and Soumya Srivastava, who lead the Gender and Climate Change Program at SAS Social Impact Advisors, and 10 Paryavaran Sakhis, who work with Desajapikram, a local community organization. Paryavaran Sakhai is a model where the women lead environmental efforts in their areas. The women, trained in air quality mapping, monitored 69 sites for air quality in rural Dhanbad and Bokaro, out of which they identified 26 as air pollution hotspots. Apart from air quality monitoring, the study involved 200 participants in a survey, focus group discussions, and health system mapping, with data collected over 9 months in 2023 and 2023. Today, many states in India are exposed to unhealthy air quality levels. Air pollution causes 2.18 million deaths annually in the country. Jharkhand has a third of India's coal reserves, with Dhanbad and Bokaro being major mining districts. The level of PM 2.5, the type of fine inhalable particles that can only be seen through a microscope, is almost 7 to 9 times above the WHO limit in Dhanbad and Bokaro. This study is very critical because it isn't a top-down study, which most air pollution studies are. This is a community-led study in places where the government doesn't even think you to install air quality monitors, said Sable, adding that localized studies can push local governments to find solutions. Women in Dhanbad and Bokaro mining districts in Jharkhand were trained in air quality mapping. The women, also known as Paryavaran Sakhis, co-led a recent study on the impact of air pollution on public health in the region. As a result of their efforts and findings, Central Coalfields Limited installed air quality index monitors in the region. Image courtesy of Desajapikram. The study found air pollution hotspots in unexpected places. Out of 69 sites, 20 emerged as hotspots, with PM 2.5 levels in poor 120 micrograms per cubic meter air, or GM, very poor 120-250 GM, or severe above 250 GM categories. Some locations recorded particularly alarming levels, such as a marketplace, which reached 250 GM, and a main road hit 231 GM, both in Bokaro, more than 2 times the World Health Organization's recommended limit of 5 GM. Other air pollution hotspots included not just mining areas, but also Anganwadis, hospitals, schools, and ponds frequented by vulnerable populations, such as women, children, and the elderly. I was surprised to see that places such as the market, which we thought had no pollution, had very high air pollution, said Devi. This surprised the researchers too, who did not expect such pollution in villages that are more spread out than cities, which tend to be congested, or told Mumbai, India. The study found high awareness of pollution among respondents, but also severe health impacts. More than 80 of the participants said they had health ailments associated with air pollution, with all agreeing that their air is polluted. The local residents reported several short-term health impacts, including cold and cough, breathing difficulties, headaches, and watery eyes. A majority of those with colds and breathlessness were women. Pregnant women reported feeling sick while cooking on cholas, stoves that use wood or coal as fuel, or when stepping out in the pollution. According to a study published in July 2025, when pregnant women are exposed to air pollution, they are much more likely to have babies born underweight or premature. Children and the elderly are disproportionately impacted by air pollution for different reasons, explained Dr. Sumit Ray, who heads critical care medicine at Holy Family Hospital in Delhi. He was not involved in the study. The elderly have several years of exposure to air pollution because of their age, and they also have declining organs, which makes them vulnerable to polluted air. Children play and run around a lot, breathing faster and deeper, and air pollution impacts their lung capacity and immunity, which is still developing. If women have added exposure to indoor pollution from cooking on a chulha, it can lead to chronic lung damage, he told Mumbai, India. Rukadavi, one of the local women involved in the community-level air pollution research, teaches women in villages of Bokaro district how to check air pollution levels on an AQI monitor. Aside from mining areas, air pollution hotspots also include Anganwadis, schools, and other areas frequented by women, children, and the elderly. Image courtesy of Desaja Pikram. As part